COVID-19 was by far the most scrutinized disease and the biggest event in the health sector at the beginning of the 7th year of the current administration. From over 166,000 recorded cases and more than 2,000 deaths at the time, affected people are now more than 250,000 and there have been over 3,000 COVID-19 related deaths. On May 28, 2021, about 3 months after vaccines had arrived in the country, over 1.9 million first-dose vaccines had been administered, but only about 33,000 people had gone for the second jab. That figure has increased dramatically to almost 27 million first and over 18 million second jabs as at June 1st, 2022. Sadly, more than 1 million vaccines were destroyed because they expired in storage. In the third week of July, the Presidential Steering Committee put 6 states and the Federal Capital Territory on red alert for a third wave of COVID-19 due to an increase in daily confirmed infections. As much as 700 cases a day were being reported, but getting residents to adhere to safety protocols was an uphill task. The country endured a 4th wave commencing in late December, but by the start of April 2022, most COVID-19 restrictions had been eased following a consistent drop in daily new cases nationwide. There was a change of guard at the NCDC. Dr. Ifedayo Adetifa became DG of the institution, replacing Dr. Chikwe Ihekwazu, who went on to be Assistant Director General of the Health Emergency Intelligence at the World Health Organization. Monkeypox has been popping up since 2017 in its most recent reappearance in Nigeria, but in a twist was transported to the UK in early May of 2022 by someone who was said to have traveled from Nigeria. The disease spread rapidly to other non-endemic countries.
More than 550 confirmed cases have now been reported to WHO from 30 countries that are not endemic for monkeypox virus.
Nigeria's situation is now receiving more attention with scores of confirmed cases and 1 death.
There is no outbreak of monkeypox. I think the term outbreak is being used wrongly. Yes, we are having cases of monkeypox.
This environmental degradation we're talking about, where we're forcing animals and human beings into the same space, is really a problem for the world.
Perhaps the most monumental news within the year was the award of Maturity Level 3, a certificate which grants Nigeria the capacity to use mRNA technology to manufacture vaccines, among other medical preparations.
To get there, we needed to overcome 868 recommendations. That was as of January 2018.
This is big news because for decades the country has not produced any vaccines, but now several entities are working on preliminary models.
We didn't get the kind of immune response that we expected. We are now regrowing the cells themselves. It's taking some time. If we cannot, we'll get to buy them again.
A strike of resident doctors in August 2021 was met with the federal government's no work, no pay rule. The issues were non-payment of salaries, arrears, and hazard allowances, among other things. It was called off after 9 weeks and the signing of an MOU. According to the Nigerian Medical Association, brain drain has caused a deficit of over 315,000 doctors in the country. No doubt the health sector has navigated through some rough times and come out on top, but the same problems that assailed it are still prevalent. For the sector to transit from reacting to being ready for every health emergency, more must be done in research, infrastructure, recruiting manpower, and capacity building. Mary Alale Yusuf, Channels Television News.